activities to address the unmet needs in the fever management. The foundation is committed to conceive, build, and sustain programs and make scientific initiatives which are aimed at providing evidence-based update to healthcare professionals. The vision of the Fever Foundation is to strive towards imparting knowledge on the unmet needs and provide information on research, education, and therapy updates on fever management. So we have several activities under Fever Foundation. Some of them includes annual fever conferences, which we conduct every year, and almost 5 years we have completed. And we bring about books on fever management, and we conduct fever CME activities. And next slide, please. So we also conduct clinical and epidemiological research, and we also have challenging case presentation competition for postgraduates, and we have Young Scholar Awards, patient education, paramedical education, public awareness, and patient education, parent awareness activities. So these are some of the activities of Fever Foundation. Today we are here for the Fever Quiz competition. This is a national competition and the zonal level. The winners of this zonal level, we move on to the national conference where they will be competing the national level competition. So over to Dr. Krishna to introduce our jury members and the quiz master.
Thank you, madam. Very warm welcome and good evening to all the jury members and the doctors joining in. We have Dr. Maya and Dr. Muruganathan as the guiding force behind us to this activity. And the dignitaries today, the jury members, none of them require introduction. Dr. K. Ravi, sir, welcome, sir. He's been the former director, come dean, and also is a professor and head Department of General Medicine, Bangalore Medical College.
Thank you.
We are having with us Dr. Nagaraja B.S. He's a professor of medicine. He's a principal at Sri Atal Bihari Vajpayee Medical College and Research Institute, Bangalore. He's also been the Dean of Medical Faculty, RGHS, Bangalore. Also, shortly we'll be having Dr. Isaac Moses join with us today. He's been the former Dean at Stanley Medical College, Madras Medical College, Chennai. Welcome, sir. Thank you very much. Also, in the expert panel, we have Dr. Anupam Prakash, Ghanshyam Pankte, Ramesh Agarwal, and also Jayant Kumar Panda joining us today. And today's host is the quiz master will be Dr. Shubha Lakshmi Margrekar. She is a professor at the Department of Medicine, Lady Hardinge Medical College. She has also been the coordinator in chief for Thalassemia Adult Daycare and at Medical College, New Delhi. She has several publications to her credit and contributed to many books, chapters for the APA textbook of medicine. Thank you very much, and over to Ravi, sir, for the quiz connect.
Okay. Good evening, everyone. Welcome to this annual quiz program, preliminaries of the annual quiz program conducted by Microlabs as part of their annual CME and scientific program, a part of their Fever Foundation. So this Fever Foundation is already introduced by Dr. Manjula, does various academic activities, where this quiz program is one of the activities for the benefit of postgraduates, both in medicine and in pediatrics. So today we are having a preliminary quiz for postgraduates in medicine. The winners of this preliminary quiz will be qualifying for the final quiz, which will be conducted in the National Fever Foundation Conference, which is going to be held in Bangalore in the month of November. Every year, this quiz is bringing very good active participation from the postgraduate students of both medicine and pediatrics, where the winners will be participating in the final. So this is the preliminary quiz which is being conducted today. Thanks to Fever Foundation and Microlabs for taking up this initiative where we update our knowledge on fever, which promotes research activities on Fever Foundation, on the topic of fever. Thanks and welcome all our panelists who are there today for conducting this quiz program for the benefit of postgraduates. All our quiz master also is ready. Before handing over the mic and the program to our quiz master, the basic rules and regulations which is there displayed, I will just go through those rules and regulations which all the postgraduates or the participants who are participating in this program should stick to the rules. The quiz is for the postgraduate students only. Please remember, any students who have already passed out are not supposed to participate in the quiz. The quiz consists of multiple choice questionnaires. You will have a question and you will have answers. Probably 3 or 4 multiple choice answers will be there, and you will have to choose the best answer. The option to be selected by clicking on the button on the text panel which is there. The video display with options will be only for representation purpose only. The participants are advised not to leave the platform in between when you are participating in the quiz. One answer is to be submitted. It will not be possible to revert. Please remember, only one answer for each question, and you will not be able to revert back. You will have 20 seconds. Actually, please remember, once the quiz question is displayed and the answers are also displayed, you will have 20 seconds. So be calm, look at it, and because you will not be able to revert once your answer is submitted. No negative marks for the questions, for the answers, so you can boldly answer. The winner will be the maximum fast right answers. That is, you will have multiple participants are there from all over the South Zone. So whoever does the fastest finger first will be the winner. And there is a team from the Microlabs. Thanks to them, they are looking after all these things. If there is a tiebreaker round will be done to decide the. Can I just go back? Yeah, if there is a tiebreaker round will be done to decide the winners, that the jury and the quiz masters will decide if there is a tie. It is advisable to use the laptops or desktops. Please, all participants, don't participate on your mobile phones. It is highly advisable to use your laptops or desktops so that you can easily participate and have the options. Next, please. So, advised to participate from a place with good internet connectivity. I request all the participants to sit in a place where there is good internet facility, because sometimes with a bad internet facilities, you might sometimes lose the connections. So always sit in a place with a good internet connectivity with a laptop or a desktop. If found to be any type of foul play, will be automatically disqualified. So participants are requested not to use your mobile phones for all those things to find the answers. And you won't be able finding time also to find the answers, because you have only 20 seconds. So don't go into all those things. Should not use mobile phones for getting answers from any colleagues or sitting nearby. Fever Foundation is not responsible for any form of technical error. That is, I already mentioned to you, kindly use a good room with a good net connectivity. Participation in the quiz implies that the participant accept the integrity of these rules. Always remember, this is for the participation. Always participation is important. Don't think that you have to win or lose. So it all gives you the knowledge of these questions which you are going to come across. The participants who have given incomplete or inaccurate personal and contact details will not be allowed. Non-compliance with the rules results in automatic cancellation of the participants in the candidates for the prize. The first and second winner from each zone will enter the national level quiz at FEFCON 23, scheduled in November 2023. The dates will, of course, be notified to you. Quizmaster and judge decision will be final if there is some ambiguity in the answers. So these are the rules and regulations. I welcome all the participants once again, wishing them good luck for your participation. I also thank the jury members, the quiz masters, everyone for having participated, the Microlabs and all the team from the Microlabs for giving us this opportunity to be part of this quiz. Over to the quiz.
Thank you, sir. Thank you, Ravi, sir.
Over to you, madam.
Nagaraj, sir, can we have your introductory remarks and then we can start the quiz?
So I welcome and thank all the participants for participating in this quiz. So winning is important, but it is not only important, but participation is more important than winning. And I wish all of you a joyful learning exercise during this quiz. I wish all the good luck to all of you.
Thank you, Nagaraj, sir. And over to Shubha Lakshmi, madam, the quiz master for the day.
Thank you very much and welcome all the participants for this day 2 of quiz with South Zone. And not wasting much time, moving on to the quiz. So first question for the quiz, Computer Ji, may we have the first question?
I think you have the dummy questions.
Okay. Yes, sorry. So first we will be having 3 dummy questions so that we are accustomed to how to participate and how we have to click the answers. So we don't have to click the answers in the answer written. We have to click it downwards where it is the space is given for that. So for that, first question is, which country is called the land of rising sun? Is it New Zealand? Is it Australia, China, or Japan? Your time starts now. Okay, so time is up. Computer Ji, may we have the correct answer for this? So Japan. So as this is a we are studying from our school time that rising sun, land of rising sun, Japan is known for it. And let us see how many of our participants are good in this general knowledge also, or I think Computer Ji will take some time to. Manjula ma'am, we have this scoreboard for this also, right?
No, ma'am. For this, they
No?
won't give the scoreboard.
Okay. So can we have the second
The
question?
percentage they may show. Percentage they will show. They
Acha,
may not show
okay.
the winner.
Okay.
Yeah, they
So
will show the
percentage.
percentage. Yeah.
If we have ready percentages, yes. So, okay, 67 of us has rightly answered that Japan is the land of rising sun. Very nice. So, moving on to the next dummy question. Computer Ji, may we have the next dummy question for this? Yes. So, which star is nearest to our planet? Options are Sun, Ceres, Vegas, and Mercury. So, our time starts now. Okay, so time is up. Again, a question from science of, I think, 3rd or 4th standard. So let us see what we have answered. Computer Ji, may we have the correct answer first? Okay, so the sun is nearest to our planet, which is the star which is nearest to our planet. So sun is the star, and this Mercury is again a planet, so it cannot be the answer. And rest we also need to study science, I think, again, so that we can answer it correctly, or we can know what is not the answer of this question. So whenever Computer Ji is ready with the score, we can just have it. Okay, so yes, 42% of us are going with the answer sun, and Mercury 45% has answered at Mercury. So this is how this quiz will be moving. So we can just have quick third question and then we will move on to the quiz. Third question, Computer Ji. Yes, so it is the largest living mammal. Is it blue whale? Is it elephant? Is it rhinoceros? Or is it hippopotamus? So your time starts now. Yes, so time is up. Again, a question of animal kingdom. We should be knowing about it, and very commonly asked question in our exams also. So if we have the scoreboard ready, we can just have. Computer Ji, what is the correct answer? First, may we know that. So it is blue whale. So we have read from school days that blue whale is the living mammal on the earth, and rest are the elephant, rhinoceros, or hippopotamus. They are also very big, but yes, they are not the largest. So if scoreboards are ready, we can move. And this is how our quiz will be. So yes, very nice. So 88% still remembers our school days and they are correct in their answer. So very nice. So I think you have understood where we have to click for the correct answer or where we have to click for the options. And then this is how we will be moving for our quiz. So ma'am, should we start with the quiz? Okay, so all the best to all the participants, and we are moving on to the quiz now. So Computer Ji, may we have the first question of this quiz? So the decisive criteria to distinguish active pulmonary tuberculosis from non-active pulmonary tuberculosis sequelae in the lung is scattered foci or nodule in the apical part of the lung, cavity in the apical segment of the right lung, obliterated costodiaphragmatic sinuses, or excretion of Mycobacterium tuberculosis with sputum. Your time starts now. Okay, so time is up. I hope you all have option or you have clicked the option. So Computer Ji, first may we have the correct answer? Okay, so the correct answer is excretion of Mycobacterium tuberculosis with sputum. So it is a very important clinical scenario which we face in our day-to-day practice, where we have patient come to us with some cough or mild symptoms with X-ray findings of some doubtful lesion in the X-ray, where we are stuck like this patient is having active pulmonary tuberculosis or it is a sequelae of its past tuberculosis if the patient is already had history of tuberculosis. So there we have to make decision whether to treat or not to treat, because it is important. If we left it untreated, then it can be fatal, or the disease may be progressive and can take a bad shape. So as we know, it is a very widespread problem, especially in our country, and still one of the leading cause of mortality if left untreated. As I told you, it can be categorized into active TB or healed TB. So this post-tuberculosis sequel or healed TB are the same, where we need to diagnose. So for diagnosis, as the options are, we have to go with the X-ray findings, we have to go with the this sputum examination. Many other investigatory findings are also there, but yes, confirmatory, or you can say sputum examination with positive AFB bacteria in it will be the confirmatory one. If it is there, definitely we have to treat the patient, and the patient is suffering from active tuberculosis. Rest of the finding can be there in any other illness also. So we have to go with the sputum finding, or sputum positivity report will be helpful in starting the treatment. Otherwise, yes, okay. So we have the score. 57.89% of student has answered it correctly. Very nice. So it is very common disease and we should be knowing about that. So if we have the fastest finger for this first question, so it is Madhu Sai from Karnool. So congratulations, Dr. Madhu. You have answered it in 6 seconds. That is very nice. So important topic and very nicely answered. So moving on to the next question for the quiz. Which of the mentioned method are included in the obligatory diagnostic minimum for patients with suspected tuberculosis? Options are bronchoscopy, bacterioscopic and bacteriological examination of sputum, retinograph of lungs, and bronchoalveolar lavage. Your time starts now. So the time is up, and Computer Ji, may we have the correct answer first? Okay, so the bacteriological examination of sputum, as just discussed, because there is battery of investigation which we order or which we ask for confirmation of the patient when we are suspecting any patient to be of tuberculosis. But what all things should be included or must be there in the battery? So one of them, or very important, is this bacteriological examination of the sputum. Rest are also important, like bronchoscope. It is not done in all the patients. It is specific for a specific condition. And bronchoalveolar lavage, when bronchoscopy is done, if we are suspecting something, we have to go for bronchoalveolar lavage and look for the organism if it is there, because we are suspecting strongly. So these are the options, and we have to, this bacteriological examination of the sputum should be there in battery of investigation whenever we are suspecting tuberculosis. So Computer Ji, if we are ready with the scores, we can have it. In radiological examination, we may have X-ray findings. We can go for X-ray, or CT scan of the chest can also be done if in doubt. But if everything is like we are still in confusion, and if we get a report of sputum positive, then definitely we have to think positivity of the tuberculosis. Any of our expert, if we want to add anything?
Yeah,
Sir?
madam, if you permit, this regarding sputum examination, majorly
Yes.
what we'll be doing is sputum for AFB and as well as CB-NAT. And a word
Yes,
of
yes.
caution, whatever young postgraduates, what I want them to remember. Okay, when you are treating a patient, recently he has been treated, last 1 year he has been treated, and we have to use a caution. If you are using CB-NAT, very widely we are using for its high sensitivity and specificity. Okay, one of the limitation of CB-NAT, what you should remember is, if the patient has been treated in the last 1 year, you should never take CB-NAT as a test for your confirming active tuberculosis. Then it has to be sputum AFP. So it can come falsely positive. CB-NAT can be falsely positive if patient has been treated for tuberculosis in the last 1 year. So that caution should be there while interpreting the CB-NAT.
Thank you
Okay.
very much, sir, for adding this information to us, and as well as for the students. So we have the scoreboard now, and 68.75% student participants has answered it correctly. So we have to go for sputum examination, and Dr. Sandesh from Hassan has answered it in 6 seconds. So today it is for 6 seconds. Everyone is answering in 6 seconds. So that's good. That's good. Or now moving on to our third question. So Computer Ji, yes. So the place of viral entry in the infectious mononucleosis cases is damaged skin. Option B, mucous membrane of the gastrointestinal tract. Option C, tracheal epithelial cell. And option D, nasopharynx. Your time starts now. Okay, so time is up. Computer Ji, may we have the correct answer first? Then, okay. So the option D, nasopharynx, is correct answer. So as we know, this infectious mononucleosis is a clinical condition. It is characterized by fever, fatigue, pharyngitis with cervical lymphadenopathy. Lymphadenopathy is very common in these infectious mononucleosis cases, and it is often spread by contact of infected saliva. Once the person has had infectious mononucleosis, the virus remains dormant in the throat, and the symptoms can take 4 to 6 weeks to appear after the infection is entered the body. And it is, yes, it is very common. It is caused by Epstein-Barr virus, which is very important to note. And sir, if any one of us can add something to this, any of our expert. So if in acute illness, there is high viral load of these in the oral cavity of the patient who is suffering from infectious mononucleosis, and so timely treatment of these patients or diagnosis is also very important, so that we can treat the patient. Computer Ji, if we have the ready with the scoreboard, we can have that. again, very common symptomatology, fever, fatigue, and lymphadenopathy. Differentials are many, but yes, we have to look for the mode of entry or the cause of infection or how that has happened, why it has happened, so that the history can make us wiser in making the diagnosis.
Video.
Computer ji? Okay, so other options were like damaged skin or gastrointestinal tract. Okay, computer G is ready with the option answer, and it is like 69.39% participants has answered correctly. That is nasopharynx. So good. There is some doubt in some of the participants still, but it is okay. So computer G, who was the fastest finger in this question? Can we have the name of that? Okay, so Dr. Rakshit M from Bangalore Medical College and Research Institute. Congratulations, Dr. Rakshit. So very nice. You have answered it in 5 seconds. So good job. Keep it up. And we can move on to the 4th question. Computer ji? Yes. So for the treatment of hemorrhagic fever with renal syndrome, the following medicine have shown efficacy: amantadine, ribavirin, interferon alpha, pegylated interferon alpha. Your time starts now. Okay, so time is up. And computer ji, may we have the correct answer first? Okay, so the answer is ribavirin, option 2. So this hemorrhagic fever with renal syndrome, it is a zoonosis caused by hantavirus, and the reservoir host of hantavirus is field mouse, so from which it can be spread. The manifestation include acute kidney injury, increased vascular permeability, coagulation abnormality and all. So patient may present to us with kidney abnormality, acute renal failure, or along with that, there may be some bleeding diastasis or coagulation, as coagulation profile is deranged in this patient. The phases may be there in these patients, like a febrile phase, hypotensive phase, oliguric phase, polyuric phase, and convalescent phase. So treatment options, what treatment options are there for this patient? So we have to take care of the hydration. We have to treat the patient symptomatically. Dialysis is required if renal function is very much deranged. And yes, IV ribavirin therapy has seen to be significantly efficacious in this condition. Mortality has been reduced, and it should be started within 5 days or as early as possible. It will be helpful for the patient, and there is significant reduction in the risk of a patient moving on to the oliguric phase. So we can prevent oliguric phase if the drug is started timely. Many studies are there who has seen the efficacy of this treatment. So option, okay, so only 13.73% of student participants have answered this answer correctly. So again, this topic is, it is not very common, but yes, as it is a fever quiz, we need to read some of the rare diseases also. So we have multiple questions. We can, this thing. So Dr. Nithin from Chennai, ACS Medical College, Chennai. Congratulations, Dr. Nithin. He has taken 10 seconds. So I think this was not an easy one. So, but congratulations, Dr. Nithin, for answering it correctly and quickly. Can we move on to the next question, Computer Ji? Yes. So the first clinical symptoms characteristic for a tetanus patient: A, trismus or lockjaw; B, rhizus sardonicus; C, opisthotonus; and D, A plus B. So the time starts now. Okay, so time is up, and Computer Ji, first may we have the correct answer. So okay, so answer is D, that is trismus and Reiser's sardonicus. Both are the clinical pictures which appear first in these patients. Tetanus, very common condition. It is caused by Clostridium tetani bacteria, and when these bacteria enter the body, they produce a toxin that causes painful muscle contraction and lead to various symptoms. This trismus is also known as lockjaw, as there is difficulty in opening the mouth and all the muscles goes into spasm, and stiffness of abdominal muscle as well as back muscle also appear. So this opisthotonus is a condition where abdominal muscle stiffness lead to bowing of the body. Bow-shaped body is there in these cases, and fever, sweating, tachycardia can also be there along with that. And yes, this Reiser's sardonicus is highly characteristic abnormal and sustained spasm of the facial spasm, a facial muscle that appears to produce grinding. So this is very specific, but can be seen in multiple other conditions. And if this Reiser's sardonicus along with trismus is there, then high susceptibility that we are dealing with a case of tetanus with a history of trauma or something like that. So can we have the scoreboard, Computer Ji? Tetanus is a condition where it is more common in field workers. Any of our expert, if we want to add something, sir, can we add?
And most common, this one will be trismus only. Around 70 to 80%. That is the most commonest.
Most common.
So,
Yes,
yeah,
yes,
right.
okay.
And the question also was a little tricky, I think. The first symptom they had asked, probably they must have been a little confused.
Yeah.
Okay. Okay. So as our jury is with the option A, so we will taking option A as the correct answer for this. And
No, B, A and
No. Take
no,
your
no,
answer,
no.
madam.
A and B.
A and B is correct, madam. What you have done is correct. I mean, just giving, that is one of the commonest symptom. But you have asked for earliest symptom.
Earliest. So I think the
Yes,
answer
yes,
is right, madam.
okay, okay, sir. Computer Ji is taking a bit time, I think. So
yes, computer also needs more time.
okay. So okay. So as we have gone with D, 20% of them has answered as A plus B. 70% has answered as lockjaw or trismus as the first symptom or earliest symptom. So, but as we have decided, so D will be the correct answer. 20% of the student or participants have answered it correctly. So, Computer Ji, who has answered? So, Yara Manini, Dr. Yara Manini, he's from Chennai. So, congratulations, doctor. You have answered this question in 7 seconds. Very nice. So, a tricky question with a quick answer which was required and was a bit difficult also. So, Computer Ji, can we move on to the second question? Next question. So, how long can the influenza virus survive in the living room? Option A, some hour. Option B, some days. Option C, some week. And option D, some month. Time starts now. Okay, so time is up. Computer Ji, can we have the correct answer first? Then we will discuss. Okay, so the answer is some are. So influenza, as we are all aware, it is an infection of nose or upper respiratory tract, that is nose, throat, lung, which are part of respiratory system. And it is commonly called the flu, but it's not the same as other flu. It is where patient can also present sometimes with abdominal complaints also, but yes, upper respiratory complaints are the commonest. How long this virus can survive, it depends mainly on the type of virus, how warm or moist the surroundings are, and the type of surface it has contaminated. So it is important to note that. So in general, influenza A virus remains infectious for up to 4 hours, but rarely more than 9 hours. So some hour is the correct answer, not more than 24 hours. So somewhere between 4 to 9 hours is the time duration. And if extended in the cold, where the cold virus can remain infectious for up to 24 hours, but it is also not very common. So some hour is the correct answer for this question. And people who are extreme of age, like younger children under the age of 2 or elderly population above the age of 60 or 65, they are at risk of developing flu, acquiring, and complications are also more common in these patients. Any of our expert, if we want to add anything, sir?
Nothing, madam. I think you're rightly put it. It's probably a few hours. It is usually active and they are infectious, particularly the influenza A virus. And I think the answer, most of them, I think 45% of them you can see over there have got
Yes.
it right.
Yes. So it is important to note. Some are. Yes. Okay. So can we have the fastest finger winner for this question? Question 6. Dr. Yahoda from Coimbatore Medical College and Hospital, Coimbatore. So congratulations, doctor. You have answered correctly and in 6 seconds. That is very nice. So for every question, we have a different winner. In all the 6 questions, we have 6 different participants holding this position. So very nice. Computer ji, can we move on to the next question? Yes. So this is the 7th question. Which examination is very important for establishing the diagnosis of chronic hepatitis? A, biochemical, B, morphological examination of liver, C, serological, and D is liver ultrasound. Your time starts now. Okay, so time is up. Computer ji, first may we have the correct answer? Okay, so morphological examination of liver tissue is the correct answer for this question. So what examination actually, or why it is important to establish, or how we have to establish it? Firstly, we have to go with the history. We should know the duration of the illness, duration of the hepatitis that patient is having, so that we can label it as acute or chronic. Then definitely for serological examination, IgM or IgG, if it is there, then we can again differentiate into acute or previous infection. Morphological changes in the hepatic tissue after spontaneous seroconversion or after treatment can be seen, or it is helpful in follow-up also. So it is important. And yes, always biopsy is the mainstay for diagnosis. Nowadays, there are multiple things which are available with us, like liver ultrasound or fibroscan or multiple other things. But yes, that liver biopsy is the gold standard for making the diagnosis of chronic hepatitis. Serology will help us in making the diagnosis, but chronicity will be definitely be told by in liver biopsy and liver ultrasound. There we can know the grading of the disease, but chronicity or the diagnosis will be a little difficult to be said on the basis of ultrasound. So any of our expert, if they want to add anything?
Madam, as you suggested, morphological examination or a tissue biopsy is an invasive procedure, even though it is gold standard. Practically,
Yes.
while in the practice, so most of the times it will be serological examination. Finally,
Yes.
our goal is to treat our patients. Treating patients, most of the consultants, what we are doing, and you'll agree with me, it's serological
yes.
examination. Very rarely
Yes,
we'll go for tissue biopsy.
Yes,
So
definitely.
even though it is a gold standard, utility will be
Yes.
with serological tests.
Yes. So here we have 23% has answered it B and 54.90% has answered it as C. So computer ji, can we have the doctor who has answered this answer correctly? So Kruthi from Kolar Medical College, SRI Devraj URS Medical College, Kolar. Yes. So she has answered this question in 8 seconds. Congratulations, Dr. Kruti, for answering it correctly and quickly.
Again, a
So
new
very-
entrant.
Yes. So every question has a new winner. We have 7 questions, 7 winners. Very nice. Congratulations to all. And rest of all, yes, gear up. And your next name should be yours. So moving on to the 8th question, Computer Ji. So the average risk of seroconversion after a needle stick injury with HIV infected blood is approximately 0.003%, 0.3%, option C 3%, and option D 30%. So Computer Ji, your time starts now. Okay, so time is up. Computer Ji, can we have the correct answer first? Okay, so the answer is B, 0.3%. I hope this is a easy one and all must have answered it correctly, but let us see. So very importantly, needle stick injury, as healthcare worker, we are all aware, and it is not a good thing whenever any student or any doctor has this thing. And yes, they are risk of HIV, HBsAg, HCV. So multiple thing we have to take care, or multiple thing are there in mind whenever any student get prick from any needle in the wards. And yes, the transmission rate, you can say for HIV, it is 0.3%. For hepatitis B, it is 33%. And for hepatitis C, it is 3.3%. So this is the 33, 3.3 and 0.33. So this is how we can remember. And it is important to note. Ghanshyam sir, Dr. Najraj sir, if you want to add anything to this question.
Yeah, this needle stick injury is a big problem for our residents, and they should be very cautious whenever they take samples and all. And like Dr. Subbalakshmi has already told, 0.3% means out of 300%, 1% may get a needle stick injury and may lead to HIV also. But good thing is we have a post-exposure prophylaxis also available with that. For PEP now, it should be given as early as possible and can be given up to 3 days or 72 hours. So we have a new regimen like lamivudine with jadavudine and dolutegravir. So these all are available, but best thing will be just prevent the needle stick injury and just be cautious and whenever you take the sample.
Thank you, sir. I think with those post-exposure treatment with these antiviral agents, the rate of seroconversion also can be increased.
Yes.
Good. Thank you, sir.
So we have the answers also. So 58% have answered correctly. I was expecting 100%, but let's see who has answered it quickly. Computer Ji, may we have the name of the participant? Dr. Fatima from Bangalore Medical College. So college is same. I think one more student is from there, but yes, doctor is different. So participant is Dr. Fatima. Congratulations. And she has taken 7 minutes to answer this. Very nice.
7 seconds.
Yeah, 7 seconds, sorry. So, okay. So moving on to our next question. Computer Ji, may we have the 9th question? Yes, the most important point for the diagnosis of malaria is epidemiological anamnesis, blood culture, microscopic examination of the thick and thin smear, serological examination. Time starts now. Okay, so time is up. And again, Computer Ji, maybe have the answer first, then we can discuss a bit. C is the correct answer. microscopic examination of the thick and thin blood smear. Again, I think a easy one for our participants. So I hope many of them has answered it correctly. So, sir, if we want to add anything, then I can be discussing any of our expert if they are available.
I think
So-
that is the gold standard, madam. Microscopic
Yes,
exam
yes,
of the thick smear using your Jimsha stain.
yes,
think
sir, yes.
They should be pick it up, I think.
Yes, I think also. So thin smear is to discover the species of the malaria, and thick smear is for detecting the presence of bacteria or the percentage that RBCs are infected. And others are like epidemiological survey, just will help us in telling how much is the disease in the this thing in population and all. But yes, gold standard, as you said, sir. Ghanshyam, sir, if you want to add
Yes,
anything
gold
to this.
standard is now still a microscopic examination only, but we know that in a crowded emergency and all, we are all are using rapid card tests, which are
Yes, sir.
very sensitive as such, but a lot of false positive or false negative reports are also there. So, but still to know the exact species and all, and going for the gold standard, we should continue this practice of making thick and thick smear also. Although
Yes.
very few labs are still doing this thing in a crowded lab.
Yes,
And
to
also for
add,
the information of our postgraduates, madam, WHO has recently updated all the guidelines for both diagnosis and management. It was from 2 or 3 months back, and it's available in WHO website. Treatment, malaria treatment.
okay,
Thanks.
sir. Thank you. Thank you, sir. Thank you. So, Computer Ji, if we are ready with the scores. And yes, to add, clinical history and examination is must. So these are all gold standard, which will confirm the diagnosis. But yes, if any fever with present to us, we should be taking a proper history. Sometimes clinical suspicion, and many times we have to treat according to our clinical suspicion only, because these exam, like sir also said, many times it can be false positive, what kit we have, or this thick and thin smear also may not come positive always. So this is how we have to look any case of fever if we are suspecting malaria, or at that point of time if malaria is very much prevalent. So Computer Ji, if we have the scoreboard, we can move. Okay, so 95.92% of the participant has answered it option C. So that is very nice. So now malaria at least we are aware of, and Dr. Anvitha from Amlapuram has answered the question correctly within 3 seconds. Very nice, Dr. Anvitha, and congratulations. So again, a new entry to our list. So 9 question, 9 winners, 9 fastest finger first. And let us see, then the competition is like any 20 question, 20 winners, then Dr. Manjula, it will be this thing. So every participant is a winner then. Okay, so Computer Ji, can we move on to the 10th question now? So the most effective medicine for treatment of leptospirosis is penicillin, tetracycline, chloramphenicol, or erythromycin. So your time starts now. So time is over for putting the option. And Computer Ji, can we have the answer first? Then we can discuss. Okay, so answer is penicillin. So treatment of choice for leptospirosis is penicillin. Jayant Panda sir has joined. Sir, would you like to add to this discussion?
No, actually, I'm enjoying the quiz.
Okay,
Very
sir.
interesting and relevant questions. I don't know how many have done the correct bit. Let us see the response.
Yes,
Let's
sir,
go ahead.
yes.
Kauvya.
Yes, yes, sir. Thank you, sir. So this is again a bacterial disease caused by Leptospira, and in human it can cause a wide range of symptomatology. Patient usually present with fever. So again, a differential diagnosis of fever is there. Multiple other complaints are there. So as fever with rash, chills, headache, body ache, all the symptoms which are there in any fever
Two
can
of
be
the
seen.
most important presentation is jaundice and hemorrhagic episodes.
Yes,
So
yes, sir.
we tell it Leptospira icterohemorrhagica.
Yes, yes, sir. So again, this thing additive points sir has told us. So very important to note. And yes, how we can treat, because treatment is very important. Once we have diagnosed timely because of our clinical acumen, then we have to treat also. So penicillin is the correct answer, and doxycycline also can be given. So these are the drugs which are treatment of choice for this disease. As early given in the course of the disease, it will be beneficial. Can we have the score, Computer Ji? In some cases or severe cases, IV antibiotics are required. Otherwise, if initially we have diagnosed it, then we can go with the oral treatment also. This leptospira actually differential diagnosis of fever. This is the thing initially which was not very much common, but now because of awareness, it is very much diagnosed nowadays. So 52.27% have answered it as option B, and as we have seen, option A was the correct answer. And Dr. Saklin from Mysore has answered it correctly in 3 seconds. So congratulations, Dr. Saklin. Wonderful job. 3 seconds is a very quick response you have given. So again, a new entry in our list with 10th question. Now moving on to the 11th question. Computer Ji, yes. So the causative organism for plague is Yersinia enterocolitica, Yersinia pseudotuberculosis, Yersinia pestis, Yersinia intermedia. Time starts now. Okay, Computer Ji, first we can have the correct answer, then we can move ahead. So Yersinia pestis. I think I hope 100% have answered this correctly. It was an easy one. This patient with plague usually present with fever, headache, chills, weakness, and one or more swollen, painful lymph nodes can be there. They are known as bubosis, and it is caused by Yersinia pestis, as the Computer Ji has already told us. And human usually get plague after being bitten by a rodent flea that is carrying the plague bacterium, or by handling an infected animal which is infected with plague. So this we have to know, because the presentation with lymph node or swollen lymph nodes, it is important to think of plague also if we are in the area where others are also having similar symptoms. And possibly their patient may present with abdominal pain, shock may be there sometimes, and skin and other tissue may turn black or gangrenous if patient is not taken care of properly, or there is severe form of illness or disease, and other organs can also be affected, leading to septicemia in plague, that is septicemic plague, where the outcome is fatal if treatment is not given timely. And treatment options are very much, and very common antibiotics which are easily available are the treatment options like gentamicin, doxycycline, ciprofloxacin, or streptomycin. So these are all given, and other than that, symptomatic and supportive treatment. So 95.75% has given the correct answer. That is very nice.
Most of them are correct. And two very important things, as Shubhalakshmi ma'am has already told you, is a cause of pandemic. Like we saw a COVID pandemic, and few pandemics are done by plague. And second is also misutilized for the biological warfare. Though infamous things are associated with this, and we have seen last bubonic plague epidemic rather in 1994, where we have distributed ciprofloxacin to the patients of contact with the plague.
Yes, sir. Thank you very much for adding the information, sir. So, Computer Ji, can we have the name of the participant? So, Dr. Sandesh from Hassan Institute of Medical Sciences, Hassan. Congratulations, Dr. Sandesh, and you have answered it very quickly in 2 seconds. Very nice. Congratulations. Computer Ji, can we move on to the next question? That is question 12. It is trismus is a characteristic sign of tetanus, diphtheria, botulism, or tick-borne encephalitis. Your time starts now. Okay, so time is up. And I think, Computer Ji, can we have the correct answer first? Okay, so tetanus is the correct answer. But yes, this trismus is commonly referred to as a lockjaw and is usually due to sustained tetanic spasm of the muscle of mastication. And although it was usually described in the setting of tetanus, it is now used to refer to as bilateral restriction in mouth opening from any of the cause. It can be facial, mandibular, or iatrogenic trauma. It can be in post any dental procedure, following any anesthesia. So there are multiple causes for this trismus, but yes, it is characteristic sign of tetanus. And in tetanus, almost as in initial one of the question also, one of our expert has added that it is almost present in 70 to 80% cases. So that was the thing. Other symptoms, as we have discussed, tetanus may have fever, sweating, headache, trouble in opening mouth, swallowing, and other features related to non-opening or unable to open the mouth. So, Computer Ji, if we are having the scoreboard ready for this question. This diphtheria, botulism, and tick-borne disease. So, their spasmodic involvement of the jaw muscle are not there in any of these disease, and they are totally different. So, unable to open the mouth or locked jaw is not found in any of the other conditions. And here in tetanus, we can see the symptoms can appear typically from 3 to 21 days after the infection has entered the body. So I think many of the participants must have answered this correctly because we have discussed, and
I think 100% must have answered correctly, yes, because this is the second time tetanus
yes.
Yes. That's why computer is taking time.
So,
and this is the one of the easily preventable disease. Just with the tetanus toxoid vaccination, you can prevent this infection. So in India, still we have so many tetanus. If you see in the rural areas, this should all be
still some has doubt, sir. Still some has doubt. So 87.50 participants have answered it correctly. And
let's see, maybe 1 second first answer. Fastest finger first, maybe earliest.
Yes, sir. So, Computer Ji, can we have the answer, this winner?
4 seconds.
4 seconds. Okay. So, Dr. Saklin for Mysore, from Mysore Medical College, Mysore. So, congratulations, Dr. Saklin. So, this is the second answer. I think you have answered quickly. So, very nice. And moving on to our next question, Computer Ji, may we have the 13th question for this quiz? So, which of the following symptom is usually common for viral hepatitis and leptospirosis? Option A, jaundice, B, acute renal failure, C, lung edema, and D, brain edema. Your time starts now. Okay, so time is up. Can we have the correct answer first, Computer Ji? So the answer is jaundice. So as we know, as we have just seen, this leptospirosis is caused by leptospira. Jaundice can be there in leptospirosis as well as in viral hepatitis. This viral hepatitis can be of any, maybe because of any virus, A, B, C, D, E. Any of the virus can cause hepatitis with jaundice. But other options like acute renal failure, lung edema, brain edema. So acute renal failure can again be seen in leptospirosis. But in hepatitis, it can be a complication, but not the initial presentation. And this leptospirosis usually present with headache, body ache, jaundice, vomiting, abdominal complaints like diarrhea, skin rash. These all can be present in this. Computer Ji, if we have the score, or any of our expert can add.
Madam, if I can add,
Yes,
clinically
sir.
also it's very important to differentiate between where investigations will definitely help. But
Yes, sir.
some of the clinical clues we should have to differentiate between viral hepatitis and usually viral hepatitis means hepatitis A only will be a differential diagnosis for leptospirosis, not B, C, or this one, because they also both can have intestinal symptoms. So
Yes,
one of
sir.
the two what our postgraduate should remember is, so simultaneously both fever and jaundice can be there in leptospirosis, but not in hepatitis A. As the fever subsides only, jaundice will appear. That is the one clinical clue what they should pick up clinically to differentiate this.
Yes, sir, definitely. So this is very important to note for the resident because history is very important in any of the clinical scenarios. And 97.87% of this participant has answered correctly. Very nice. So Computer Ji, can we have the participant's name who has answered it quickly? So Dr. Madhu Sai for Kurnool has answered it correctly within 2 seconds. So very nice and congratulations. Again, this is a second question. I think she has answered correctly. So moving on to our next question, Computer Ji. Can we have the 14th question? So the most frequently occurring clinical symptom is sigilosis is A, vomiting, B, increased body temperature, C, abdominal pain, and D is bloody diarrhea. Your time starts now. So the time is up for clicking the option. And Computer Ji, maybe have the correct answer first. Okay, so bloody diarrhea is the correct answer for sigilosis. As we know, sigilosis is etiological agent for dysentery. Very commonly, we study it from a longer time. A clinical syndrome of fever, intestinal cramps, frequent passage of small bloody mucopurulent stool is attributed to this Shigella infection. And usually it evolves through 4 phases: incubation period, watery diarrhea, dysentery, and the post-infectious phase. The incubation period usually lasts from 1 to 4 days, but may be as long as 8 days. And typically, initial manifestation are transient fever, limited watery diarrhea, malaise, anorexia, as in any other abdominal complaint. And sign and symptom may range from mild abdominal discomfort to severe cramps, diarrhea, fever, vomiting, and trismus. And the initial phase may represent the only clinical manifestation of sigilosis, especially in developed countries. And dysentery follows within hours or days and is characterized by uninterrupted excretion of small volume, bloody mucopurulent stool with increased tenesmus and abdominal cramps. So we are already aware that this dysentery is caused by sigilosis, but yes, this is the most frequent because all the other symptoms are also present in sigilosis, but most frequent which is seen is blood and diarrhea. So Computer Ji, if we are ready with the scoreboard, we can have that. Okay, so 66.67% participant has answered it correctly, that blood and diarrhea is the clinical manifestation, which is very much frequent in infection with Shigella. So can we have the name of the participant, Computer Ji? Okay. Akram from Government Stanley Medical College, Chennai. Congratulations, Dr. Akram. And he has answered in 3 seconds. So very nice. Congratulations once again. So moving on to our 15th question. Yes. So Computer Ji, yes. In which of the following viral hepatitis in which of the viral hepatitis case should the pregnancy be discontinued? Is it viral hepatitis E, B, C, or none mentioned above? Option time starts now. Okay, so the time is up. Let us see what Computer Ji has to tell about the answer. Computer Ji, can we have the correct answer first? Okay, so none mentioned above. So it is a very critical time or a difficult time to decide for patient as well as for the doctor. So let us see some literature. What is there? Like in viral hepatitis, in pregnancy, it can be of any etiology. Any means any virus can lead to hepatitis in pregnancy. Hepatitis E is very common in pregnancy, and if it is there, the outcome is guarded. And B and C can also appear. According to the guidelines also, during pregnancy, the antenatal visit of the patient, the hepatitis screening is done in all the patients, which is now according to the guideline. And usually in every setup or in every institute, it is followed also to take care of the mother as well as the fetus, and adhering to this screening guideline to reduce the mother to child transmission of viral hepatitis. And it comes under government programs also. It is the most common this thing which is seen in pregnancy, and we have to take special care while dealing with these cases if they came out to be positive and B or C. But yes, it has to be decided by a team of experts where gynecologist, hepatologist, and radiologist and fetal medicine people decide. But yes, it is not contraindicated. None of the condition is contraindicated where the lady is asked to discontinue the pregnancy just because he is positive for any of the viral illness. And this hepatitis A, B, C, or D, this type of illness. So 57.45% has answered it E. So as I have just discussed, E is has guarded prognosis in pregnancy, but yes, it is not a contraindication, or no one can just say ki it is that patient or female cannot conceive if if she is hepatitis E positive. So, sir, do you have anything to add to it?
Madam, only thing what I want to tell is recording the counseling is very, very important, because I remember a gynecologist being sued for this because she was not told about transmission to the child. So recording and counseling is very, very important. And also it is very important if their hepatitis B positive, and they should be extended the antiviral treatment at least in the 3rd trimester so that you can reduce the transmission. And also immunoglobulin, but counseling is very, very important. We should take the consent of the patient regarding taking any decisions in this context.
Very correctly added, sir. Counseling and patient should be in this team. That team which has to decide, patient is an important member of that team, patient and relatives. So Dr. Sakleen from Mysore Medical College has answered correctly within 2 seconds. So very nice, Dr. Sakleen. Congratulations. Moving on to our next question. Computer Ji, can we have the next question? Yes, the most common concomitant disease in HIV-infected IV drug user is hepatitis B, syphilis, hepatitis C, or hepatitis D. Your time starts now. Okay, so time is up now. Now we can have the correct answer first. Computer ji, can we have the correct answer? Okay, so it is hepatitis C. So very important question and pertinent also. So concomitant disease in HIV infected IV drug abuser. As we know, HIV only per se patients are immunosuppressed, so they are more chances of acquiring any infection. But if this HIV patient is also IV drug abuser, then again it is additive to it. So this HIV with IV drug abuse patient are prone for hepatitis B infection, hepatitis C infection both. But yes, the percentage of hepatitis C infection is roughly about 39 to 40%. So it is the commonest concomitant infection when these HIV infected people is a person is IV drug abuser also. So hepatitis C is the correct answer. So may we have the score for this? So okay, so IV drug users are prone for any, like this HIV infection is also very common in these IV drug abuser. So these are HIV drug abusers are prone for HIV infection, hepatitis B, hepatitis C, or any other. They are also very much immunosuppressed. So if they are suffering from HIV or HIV individual is suffering for is a case of IV drug abuser, then this immunosuppression or is very much in these patients, and CD4 count is also very much low if in these patients as seen. And then we have to check for the other viral infections like B, C, and other tuberculosis and other infections, opportunistic infections also should be checked for in these type of patients. So we have scoreboard, and 70.21% has answered it as A, but answer was C, that was correct, and 27.66% has answered it correctly. So let us see. So C is more common because IV drug abuser are more prone for hepatitis C infection than B. But yes, both can be there. So can we have the name of the participant? Okay, Dr. Radha from Bangalore, BMCRI Bangalore, has answered the question correctly in 4 seconds. Congratulations, Dr. Radha, very nicely answered and quickly answered. So congratulations, and may we move on to the next question, that is question number 17. Computer ji, can we have, yes. So which of the following organ is mainly damaged in rabies? Cardiovascular system, CNS, lung, or liver? Your time starts now. Okay, so time is up for this question. Computer ji, can we have the correct answer first? Okay, so the option B, CNS, is the correct answer. So the organ which is mainly damaged in rabies infection is CNS. As we are seeing in news and media also that dog bite is increasing day by day in every year, and there's dog bite in cases are coming up where the rabies is a very deadly disease, as we know. So there we have to go for post-exposure prophylaxis. And yes, CNS, the acute infectious disease of the CNS, which is rapidly progressive, leading to other symptoms and manifestation. And rabies, encephalitis, and paralytic form of rabies is there, which progress to that after, and it is actually a deadly disease because if the infection has sets in, we have this medicine or immunoglobulin or whatever vaccines we have available with us will not help. So this is very important to know. And this rabies is a infection which is very much increasing day by day because of the increased incidences of dog bite. So we should be aware of the disease and the topic. So computer ji, if we are ready with the option, So the most characteristic pathological finding in rabies is Negri bodies. It is a postmortem finding, what we can see. In many of the cases which are reported there, this patient don't remember the history of dog bite, but after that, when the autopsy is done, then Negri bodies are found. So it is like that. So 95.65% of the students have answered it correctly. This is very nice. So CNS, this is the organ which is affected in rabies. So Computer Ji, can we have the name of the participant who has answered it quickly? So Dr. Saklin from Mysore Medical College has answered it again correctly. So very nice. Congratulations, Dr. Saklin, and you have answered it in 4 seconds. Very good. So again, moving on to our next question. Computer Ji, can we have the next question now? So the main clinical syndrome in botulism is cardiovascular, arthritic, neurological, or dyspeptic. Your time starts now. Okay, so time is up, and I think all have opted for the answer. And now, Computer Ji, can we have the correct answer first? Okay, so the option C, neurological, is the correct answer for this botulism, botulism infection. So what is botulism? It is actually a rare but serious illness caused by toxin that attacks the body nerves or CNS or neurological organs, and causes difficulty in breathing, muscle paralysis, and even death if not taken care of. The toxin is made of Clostridium botulinum, and there are 5 kinds of this 5 main kinds of this disease is there, like infant botulism, wound botulism, foodborne botulism, iatrogenic, and adult intestinal toxemia. So this iatrogenic can be there because of some medical reason, or this injection of some cosmetic this thing can also lead to this increase in the botulism in the body, will lead to this type of manifestation in the patient. So dyspeptic, arthritic, and cardiovascular system is not affected in this botulism. But yes, it is a rare form, and diagnosis is important, and we should keep in mind the neurological involvement can be there, where muscle paralysis and breathing difficulty in the later stage can be seen. And if it is there, we should think or keep botulism as a possibility or a differential diagnosis. Computer Ji, if we are ready with the scoreboard. After any trauma also this can be seen. So, okay. So option C, 76.06% of the participants have answered correctly that neurological infection, neurological involvement is there in botulism. So Computer Ji, can we have the name of the participant who has answered it correctly? Okay, so Dr. Madhu Sai from Kurnool has answered it in 3 seconds. So very nice, Dr. Madhu, and congratulations. So moving on to our next question. Computer Ji, can we have our next question now? So which of the following symptoms is characteristic of typical para-influenza? The options are rhinopharyngitis, rhinitis, laryngitis, or pharyngitis. Your time starts now. Okay, so time is up. Computer Ji, can we have the correct answer first? So laryngitis is the correct answer for this para-influenza. This human para-influenza viruses, they are been associated with every type of upper and lower respiratory tract illness. including common cold with fever, laryngotracheobronchitis, bronchiolitis, and pneumonia. So every type of presentation can be there. Patient with this type of infection typically present with history of coryza and low-grade fever, and they may develop that classy, barky type of cough. Many times patient can have, and that is very typical. And tachypnea, irritability, fever, tachycardia, these are the other symptoms which can be there along with that. But yes, laryngeal involvement is very common in this para-influenza type of infection, para-influenza infection. And other like rhinopharyngitis is not very much common because pharynx are not actually very much affected in this. Larynx, trachea, and bronchioles are affected much in this typical para-influenza type of infection. So Computer Ji, if we have the scoreboard ready, we can have that. So there is a slight difference in the presentation of these type of patient. That specific cough which is there, which will tell you that cough is from larynx or from pharynx. That specific type of cough, that barky nature of the cough will help us in deciding that which of the part of upper respiratory tract is affected in these patients, and that will help us in making the diagnosis of para-influenza infection. So I think these type of patients we very much get in our OPD, and here also like participants are confused, I think. So para-influenza and influenza, these are slightly different etiology and slightly different entity, and option was C, and 28.26% of the participant has answered it correctly. So Computer Ji, can we have the name of the participant? So Satpati Kirti, Dr. Satpati Kirti from Kadai, Kakinada, RMC, has answered correctly it in 5 seconds. So very nice, doctor. Congratulations for that. And now moving on to our last question for this quiz. So Computer Ji, can we have the last 20th question for this quiz? So which of the following symptom is not characteristic of typhoid fever? A, rash, B, headache, C, hepatosplenomegaly, and D is severe diarrhea. Your time starts now. Okay, so time is up. So can we have the correct answer first, Computer Ji? Okay, so the answer is D, severe diarrhea. Typhoid fever, we are all aware, and every one of us has treated this disease. And many times, multiple fever episode of diarrhea patient present to us saying if this typhoid fever is long lasting, it is from 1 year or off and on it is appearing. So it is very common symptom, common disease we are dealing with. And sir, Dr. Ravi is here with us. So sir, if you want to add anything, or I can just proceed.
Listening all the way. Very good.
Okay.
Some of them think diarrhea is one of the symptoms. Actually, constipation is one of the symptoms of typhoid fever because of the thickening of those pairs, patches, and all those things.
Yes,
Fine,
yes, sir. Yes, definitely. And typical symptoms, as we all are aware, pain abdomen, high fever, and mainly are the presenting picture, how patient present to us, and with a history of some intake of food from some outside food or something like that, or history of any travel that they have went somewhere and have taken some food outside. So the history is also important. Prodromal.
In any season, people take food outside, and the salmonella infection is very common. And as Dr. Ravi told, little diarrhea is seen at times, and also constipation. But severe diarrhea is not a feature. And rash, headache, hepatosplenomegaly are all very much associated. So also the classical feature of relative bradycardia, and there occurs a lot of ulcers in the intestine. So at times we see complications like perforation and further deterioration.
Yes, definitely, sir. So these are all symptomatology and complication what we see in cases of typhoid, which we very frequently observe in our OPDs, gastrointestinal complaint, along with fever, along with rash and complication. So here options we have D was the correct answer, and here only 20% of the participants have answered it correctly. So let us see who is the fastest finger. So Dr. Sundarya from Sridevi Medical College and Research Hospital, Tamkar. Congratulations, Dr. Sundarya. You have answered it correctly and very quickly in 6 seconds. So very congratulations. So this was the last question for this quiz. So I hand over the forum to our jury members who are available with us. Sir, please.
Thank you, madam. Thank you for conducting the quiz very well. Very well. Very good questions. Some of them tricky, some of them easy, some of them tough. Of course, that's how a quiz should be. Always nice questions, friend. Thank you very much for having conducted the quiz, and I congratulate you and all
Thank
the
you, sir.
organizers of the Fever Foundation for having conducted the quiz excellently. Also take this opportunity to congratulate all our participants. Students were very enthusiastic, and we could see their fastest finger moving as early as 2 seconds and 3 seconds. And I think we should also congratulate them. Either they lose or win, it's your participation which is important. Thank you, madam.
Yes, definitely, sir. And thank you very much, sir. You all jury members have given inputs in many questions that will definitely help our students for their knowledge and betterment, sir. Dr. Manjula, ma'am.
Yeah, Nagraj sir, anything would say? Panda sir,
No, nothing, madam, nothing.
Anupam
Already
sir,
I've done.
Ahmed sir. Once the scorer is compiling, and let's see
Yeah,
whether
yeah,
there will be
actually.
any chai
Yeah.
or no. Should we stay?
It's
Until the scorer is compiling, let's also feel proud and congratulate the entire team of scientists from ISRO, where we
right,
are.
sir.
Yeah.
Yeah.
I think
That
it's
is
a very
the-
proud moment for us today. I think
Yeah.
we should
The
also
biggest-
congratulate.
That is the biggest story at this hour, and
Yes,
a
sir.
landmark event for India. And the coincidence that Manjula ma'am is sitting in the Bangalore, the ISRO headquarters.
Yeah.
So we are all
Yeah,
proud,
sir.
and this event has touched even a rural Indian, and starting from the school students to the village women, all are dancing. That's
Right, sir.
great to see. If you see the television and the media, you'll feel like you are in Independence Day or Republic Day celebration. I'll tell that. Yeah, yesterday also I was there. I'll tell that today's participants are a little lucky because questions were direct, and there are questions which screened, but most of the questions were very obvious and with a direct answer. We had case-based questions yesterday, little difficult to assess. And here also, as mentioned by Dr. Ravi, very quickly people have responded in seconds. That shows how prompt they are in replying. Because not only the correct answer, the time to answer is also considered. And then all the data which is given, starting from leptospirosis to tetanus, from plague to typhoid, all are vital, important, and then very important constituent of the fever. So the postgraduates are very promising, especially few who have done multiple answers. I'll congratulate all the winners, and I'll tell that irrespective that you are selected for the final round or not, you attend the screening of all the zones and learn them, which will add to your knowledge. Thank you.
I think Dr. Shubha Lakshmi, there was a tricky question. If you just remember the trismus, the tetanus one, where it was already discussed that trismus is common in this tetanus. And so the lesson here is that the students should keep their eyes and ears open in the class and while teaching, so that they may get certain answers while the teachers are discussing. So
I told jaundice in leptospira ectohemorrhagica, and then came the important question of jaundice causes. So if you have listened carefully, you will have multiple clues. Results are ready.
Yeah.
Okay. So Manjula ma'am.
Yes, ma'am. They are going to score it. Can you show us the results, please? Ma'am, Shubha Lakshmi ma'am, to you. Or to you, ma'am.
Okay, so thank you, ma'am, and congratulations to all the participants and the winners who are listed in this list. But yes, all of you have done a wonderful job. So round of applause for all of you. Congratulations and well done. So just to name and we need winners. We need this thing. So we have Dr. Saklin from Mysore Medical College and Dr. Madhu Sai from Kurnool Medical College. They are the winner for the South Zone team, and they will be coming to Bangalore for the physical final round of the quiz. And congratulations to all, and you both have done very nice. So congratulations to you and all the best for coming to Bangalore and perform well there also. So congratulations.
Yeah. Right. Congratulations to the winner, and our Fever Foundation team will contact you and give you all the details. So once again, congratulations and all the participants. It was wonderful having you all, and all of you were very good, but only, as madam said, we need to pick 2 people, and they were much faster. Their fingers were a little faster than yours. Maybe it was their lucky day. That's it, I can say. So anybody wants to say before we close? And finally to Mr. Jairaj, if the jury wants to say anything before we close.
I wish to congratulate all the participants, madam,
Yes,
for their participation, and also to the winners. And I wish both of them good luck in their finals.
Thank you, sir.
Congratulations to the winners, Saklin, as well as the girl. And special thanks to Dr. Subba Lakshmi for conducting the quiz very smoothly.
Absolutely.
And very appropriately answering each and every option. She has explained it very well, and giving full weightage to clinical examination findings, and that should be the priority in all these medical students. And also thanks to our jury and panelists, Dr. Ravi, Dr. Jayant, Dr. Nagaraj was there full for the full time quiz, and also Dr. Ramesh did help us. Thanks to Fever team, and thank you very much for that.
Anupam sir, would you like to say something, sir? Okay. Right, sir. So thank you once again, all our panelists, advisory board members, madam. Over to you.
Thank you.
Jairaj, sir.
Let us celebrate the country's success.
Yes, yes.
Over to you, Jairaj, sir. Jairaj, sir.
Yes, at the outset, yes, let us celebrate the country's success. It's a great goosebump moment for every Indian here, and let us celebrate that. And of course, I congratulate the winners of today's quiz. And I also no words to thank our honorable ad board members, Dr. Ghanshyam Pandey and Dr. Ravi and Dr. Jai Panda sir. And also I thank Dr. Subba Lakshmi madam and Dr. Ramesh Agarwal for being with us. And also the pillars of the Fever Foundation, Dr. Manjula Suresh and Dr. Krishna Kumar. And our team, Mr. Praveen and Mr. Yash and RX Events. Thank you very much for all of us from Fever Foundation. And
thank you. Jai Hind.
Thank you.
Thank you. Thank you. Thank you very much.
Thank you,
Thank you, everyone. Thank you so much.
Thank you.
Nagaraj sir, thank you very much for being with us.
See you all
Yeah.
tomorrow.
Thank you.
Yeah.
Thank you.
Thank you, sir.
Let's celebrate on the
Yeah,
board.
let's celebrate.
Madam
This
actually